Dr. Sharda Jain. I'm Secretary General of Delhi Gynaecologist Forum. Delhi Gynaecologist Forum runs top of the line course for IVF and infertility. Very popular course in India and in neighboring countries. It's also popular in Africa. Now we have decided that in a very simple language, we are going to tell infertility patients about the state of art information, because there are many non-medicos are coming in the field who have no knowledge, and that is why the government has become very strict that the people who are posting videos must also write down qualification. Now the question is often asked that what investigations are required for male in infertility workup. It's a common practice that the lady walks in infertility center with her female relatives, and only 10 to 20% of times she comes with her husband. Husband is equally important, and first examination or first visit, it is very important. As examination and history of female is important, equally as important is the female. Along with female, the male should also get examined, and there should be detailed history. So do not forget that the male requires good examination and the history. Now what about semen analysis? It is said hormone and genetic testing are only needed when the semen parameters show less than 5 million count, or there is no sperms are seen in the semen analysis. Now in such cases, FSH is done because it plays a very crucial role in the sperm production. As for the genetic testing are concerned, karyotyping analysis is very important for one to know the number of chromosomes, the structure, and if they can identify genetic abnormalities which affect infertility. Y chromosome microdeletion is also required because specific deletions of Y chromosomes may link to infertility. It is said if it is type A or type B, no sperm retrieval will be there even by surgical techniques. So we must exactly know the genetic testing are required only when you find that the sperm count is very low or it is absent. What about the sperm DNA function test? This test is very important for integrity of the sperm DNA, which is important for successful fertilization and embryo development. And this test has become part and parcel. If 24 months have passed after marriage and they do not have a child, I feel if it's elderly, more than 30 years, then it is to be done after 12 months of infertility treatment. Now as far as the ultrasounds are concerned, they are hardly ever required unless you find there is ejaculate is a small volume and we expect ejaculatory duct obstruction, then only the imaging is required. Transrectal ultrasound is required, otherwise this kind of testing is not required. Anti-sperm antibodies have been not advocated by us, and it is also not advocated by the WHO now anymore. Oxidative stress testing is very important. Unfortunately, this is not available in the country because there are no uniformity as far as the labs are concerned, but I think in the coming time this particular testing will be required. And I think everybody needs to be counseled about the diet, about the lifestyle changes, smoking, alcohol, number of cups of tea and coffee which they can have. So it is important to know that the specific tests what are required. I have given an outline, and it will vary from individual to individual depending upon what is their history and examination and the diagnosis is concerned. If you've liked this particular video, please share with your friends and relatives who are looking for a child. At the same time, you must subscribe the YouTube channel in case if you have not subscribed so far. And if you've liked it, put a like button. Thank you very much.